The challenges are meeting the specific needs of a community with the oldest demographics in the state.
I'm actually from New York, trained in the Bronx. Kind of prepares you for everything here in the emergency medicine environment.
Science is my favorite subject, and so is the arts, and medicine is the perfect combination of both.
I've always been passionate about nursing. My dad's always wanted me to be a nurse from the time I was 2 years old because I was, putting Band-Aids on people when they didn't have owies.
25 miles south of Tucson, Santa Cruz Valley Regional Hospital is located in the senior communities of Green Valley, Arizona. Green Valley is home to more than 30,000 residents and represents the oldest communities in the state. With a median age of 72, Green Valley's Medicare population of 65 years of age and older stands at 70%, greater than 4 times the state's average. Green Valley's elderly demographic has heightened health needs and demands for local care.
It was a privilege for us to be able to provide a vaccination clinic to the community. We partnered with the fire department and Chief Wonder, and I think we've done a wonderful job with their help in having had very, very short waits and a well-organized vaccination center.
It's an at-risk population, so if we could do anything to vaccinate our local residents and get them shored up and protected as soon as possible, it makes all the difference.
The organization, the Fire Corps, the Sheriff's Auxiliary, all the volunteers who organize that event just shows how great this community is when we need help.
The hospital's primary service area extends far beyond Green Valley, down the I-19 corridor from Suajarita to the north to Nogales to the south. In total, the hospital services a population of more than 100,000 that is growing at a rate of 4.5% annually, nearly 3 times the state average. Many of these communities lack access to critical healthcare infrastructure and services, oftentimes necessitating burdensome trips to faraway Tucson for basic care. In 2021, the hospital plans to develop 2 rural health clinics in areas designated by the state as health professional shortage areas, HPSAs. The first clinic will be established in Tubac, a community 15 miles south of the hospital, and will serve over 20,000 residents in Tubac and nearby Rio Rico. The clinic will provide both daily primary care services and weekly specialty services. The hospital's second rural health clinic will be established in Nogales, a city with over 22,000 residents that neighbors the Mexican border. This clinic will provide similar services that are in short supply relative to the community's needs.
I was diagnosed with esophageal cancer in about 2011, 2012, in that area. And Sally was diagnosed more recently, and she has gone through chemo infusions and also extensive surgery in order to take all the bad stuff out. So we are both patients of the Santa Cruz Valley Regional Hospital. It plays a role in extending our longevity, extending the ability for us as community members to live a better and longer life. And we really are thankful for having our hospital in this area.
Friend had to go into emergency life-saving surgery because of a bowel obstruction. The proximity of Santa Cruz Community Hospital at that time was a contributor to the success of the whole procedure. Had Skip been required to travel to Tucson, we could have had a much different outcome.
I love working in Green Valley because the population, the gerontology population, is where I have the most passion in caring for. That has been my favorite population to work with. They're so motivated with their health, and especially in Green Valley with the active residents that live here.
Green Valley is just an amazing community all around. The population down here, they seem to be extremely gracious for everything that we do. We're always thanked, at the end of the day, you really helped me, thank you so much. And I think in the bigger cities, you don't necessarily get that. They're more of a number, as opposed to here in the community, they're very personal. It's a very personal experience.
Having Santa Cruz Community Hospital in close proximity is very reassuring for retirees like myself. One of the reasons we even moved here was knowingly having a hospital in close proximity. We can actually be from my front door to their front door in about 5 to 10 minutes.
So here at Santa Cruz Valley Regional Hospital, we're creating a all in one location quality care in a rural area that usually you would get in a larger city. What we're doing here in the rural areas of southern Arizona is we're bringing all the specialists and all the specialty service lines all into one area. The same services that you'd be receiving in a bigger city.
There's a lot to learn from both a health management perspective as well as a community perspective, and we enjoy tremendous support by the community for those reasons as well. So I think this would be an excellent area for health planners to make additional investments, because we are an aging country and we need to learn more about how to best manage the health needs of an aging population.
As the I-19 corridor continues to grow, Santa Cruz Valley Regional Hospital will continue to lead in enhancing the overall quality of life in the expanding southern Arizona region.